Welcome to Hotter Than Ever, where we uncover the unconscious rules we've been following, we break those rules, and we find a new path to being freer, happier, sexier, and more satisfied in the second half of our lives. I'm your host, Erin Keating. Welcome, new listeners. I'm so thrilled that you found your way to this conversation. And to longtime fans, it's great to know that you're out there listening to this show. I hope it makes you feel seen and heard and optimistic about all the choices and options there are for how you're going to live the next year or 5 or 20 years of your one and only beautiful life here on planet Earth. Today, my guest is Dr. Maureen Slattery. She's a board-certified OBGYN with 20 years of clinical experience. She has advanced training in sex counseling and education, and her clinical practice also focuses on menopausal care. Thank God we need more doctors focused on menopause. Maureen teaches healthcare providers about menopause and sex in Rochester, New York, and teaches about medical causes of sexual dysfunction in the sexual health postgraduate program at the University of Michigan. We have a great conversation about why healthcare providers need more education about sexuality and menopause. It's just something that is not taught to the degree that it needs to be taught in medical school. And this is a gap that Maureen is really passionate about closing. We talk about low libido. What is it? How do we define it in women in midlife? This gets thrown around, and our bodies and our current situations with our sexuality and our changing hormones get pathologized. So we talk about what you can do about low libido if you feel like this is impacting your life in a negative way. We have a great talk about raising girls who are comfortable with their own bodies and talking about sexuality, which I think a lot of parents are afraid to do, but that is so critical. I pitch Maureen an idea that can help educate women, many of whom do not know what an orgasm looks like and feels like, and how it comes in kind of different shapes and sizes, and how it's different for all of us. This seemed like a radical and revolutionary idea to me when we were talking about it at the time. You tell me what you think. It's a great girlfriendy conversation, and Maureen is a really fun hang. All right, let's get hot. Dr. Maureen Slattery, welcome to Hotter Than Ever.
Hi, Erin. Thanks for having me. I'm excited to be here.
I'm so happy to have you here. There are so many conversations we do not have about sex and sexuality. My listeners know this is my favorite subject.
Yeah, mine too.
And then, yes, good. Well, we have a lot in common already.
Yeah.
And this podcast is for women over 40, which is when we start to experience perimenopause and menopause, things that we never thought about in our youth and never knew would become such a meaningful part of our lives. And some of us, like me, just want to ignore it and pretend like it's not happening. I think I'll be in perimenopause for all of my 50s, it seems. That's just where I'm at. But I would love to hear your story and how you came to do the work you do today. It is no small feat to become an OBGYN and then to take on this specialization in sex and menopause. Like, have you always been interested in sex?
Oh God, yes. I mean, I don't know. I always thought I was weird. That was something that excited me. And I guess I was raised by a single mother, and I have I have two younger sisters. And my mom, because my dad wasn't like super great at supporting us, we were on welfare for a while when I was a kid. And my mom just instilled in all of us that like, you need to go out there and get educated and have skills to do something. She's like, don't go to college to study English, learn to teach English if that's what you want to do, or go learn to be a welder, but like be like skilled to do something so that you can support yourself. But any mom raising like 3 teenage girls, you know, each one of them is going to have their things that kind of probably drive her crazy, and she could not be everywhere and all things to all of us. And it was the 80s and the 90s where like we were freer to do lots and lots of fun things unsupervised.
Oh, yeah.
Right?
Some would call it neglect. Yeah.
Right. Drinking from the garden hose and like being home alone for hours on end.
I watched 3 or 4 hours of TV every day.
Right. Yeah. And
Mhm.
see what kind of trouble you could get into without really getting into trouble. And my baby sister was a lot younger. So I don't have a lot of memories of her kind of in her teenage years, but I like to say that like I was the one that was out like having sex with her boyfriends, which gave my mom a small heart attack. And my other sister was the one who was like smoking pot and drinking. But I mean, we all turned out okay. But I mean, even from when I was younger, I was always like interested in sex and sexuality. And I I don't have to say without like really outing myself, but like I had a healthy curiosity and would try to find out as much as I could. But it was hard back then. Like there really were not a lot of resources. And honestly, like I remember finding our neighbors had this garage that you could get into and out of, and it was full of stuff that they stored. And there were like stacks and stacks of Penthouse magazines. And so the whole neighborhood would go in there and kind of look around. And of course, that was all naked women and not really naked men, but like that was kind of where my curiosity lied. And I always thought I probably would be a doctor. I had like a roundabout like course through college and then deciding I wanted to go to medical school because it was not initially my plan. But once I got into the thick of being an OBGYN, there was a few things. One, I was getting very tired of being up all night. I can be honest about that. I did it for
Waiting for those babies.
yes. I did it for 20-ish years.
Mm.
And it's a little brutal. It's not great on your body. And I'm always have been someone who needs a little bit more sleep. And I liked the variety of my job, like doing some obstetrics, being in the hospital, operating, being in the office. But being in the office, I think, is where I shined. I like to say that, like, I had a preschool teacher of one of my kids used to wear this button around that says, I teach preschool. What's your superpower? And I used to think like, I talk to people about like sex and that's my superpower. And I was trying to find a way that I could be more of an expert in that. And so it kind of led me down the rabbit hole after like some particularly bad calls and just being exhausted all the time and missing out on things my kids were doing, that I was like, how do I learn more? Like there is no fellowship for this there. And I'm not going back to residency to do something completely different. So it's kind of how I stumbled into the program at Michigan so that I could take my knowledge of sex up a notch and use it in my everyday life. I also had found myself just looking up everything I could about sex as a professional so that when people would ask me questions, I had an actual good answer for them. Because honestly, medical school education about sex is a fucking joke. It's one of,
Explain that to me.
yeah.
I mean, is that just like a legacy of puritanical values?
I mean, maybe somewhat, because I feel like our whole society is like steeped in that like puritanical crap, and then patriarchal too, where like obviously women's sexuality and sexual health and deserving of pleasure is not something that we talk about much, whereas and girls don't know a lot about their bodies growing up either. Men have like an erection hanging off their front and they get like morning wood and
Right,
stuff, and so it's a little bit
obvious.
more in
Yeah.
their face, right?
They're not subtle. Yeah.
Not at all. But no. So even back when I was in training in the early 2000s, I remember like all of the lectures about all the stuff you need to know to not kill people, right? Like, how do you deal with someone who's hemorrhaging and pregnant? And when do you deliver someone early? And what happens when someone might have cancer and you have to take them to the operating room? Or how do you operate in an emergency with an ovarian torsion? And all of that stuff is really important. And in a surgical subspecialty, which obstetrics and gynecology is, you need to learn that. And it's the same thing for all the general surgery subspecialties. And the training is really specific to being able to succeed to that. But they just don't talk about sex or sexuality. Like we talked all day long about prevention of disease and STIs and how to not get pregnant. And then honestly, if people didn't want to be pregnant, how to help them with that. But beyond pregnancy and sexually transmitted diseases, there's really nothing about sex. And it's a shame. And I remember that because the minute I got thrown out into clinical practice, I was like, holy hell, these women have like pain with sex. And I don't think anybody ever addressed that, like in a lecture in medical school or residency or in like my clinic, because those weren't the kind of things people would come in for, or at least I wasn't asking about it as a trainee trying to learn how to like see 15 patients in like 3 hours and have to precept with someone who knew all the answers. So it's bad. But statistically, like this is where my passion now, besides like helping women with their sex lives, I really dove into some of the research about medical education in residency and in like med school. And it's just abysmal. There's something like less than 4 hours average period between the two. And that's if you're lucky, because most of the subspecialties in medicine don't even have any they don't have any educational objectives or guidelines that are just being ignored. They don't have them, period. So it's pretty sad. And so my new side mission is to educate up and coming doctors, residents locally, at least for now. I haven't been able to take my show on the road yet, but that and actually existing clinicians, because there are so many nurse practitioners, PAs, midwives, physicians who like can do real harm when they don't know what they're talking about, or when their own puritanical views or their own religiously heavy views influence what they are telling people, and they tell people wrong ass shit all the time.
So what is it that they don't know?
Oh God. Well, first of all, they just don't have the ability to be open and understand that sex is normal, that pleasure is normal, that our bodies, especially women's bodies, like our clitoris, it's got 10,000 plus nerve endings. It has no other purpose. Like a penis has got to be.
We're fucking magical.
We are.
We are magical. Like it's a miraculous thing.
It totally is. I mean, I want to jump up and down and yell at people, because men's penis will bring them pleasure, but they also have to urinate through it and they ejaculate through it. And it has multifunction kind of like purpose. It's a multi-purpose tool. Whereas like our clitoris.
It's a Swiss Army knife.
Right. Yeah. It's the Swiss Army knife of the body for men. But vagina owners, people who are born with a clitoris, like we are so lucky, because why on earth were we given an organ that has 10,000 nerve endings that is only function is our pleasure, right? That like why wouldn't we be talking more about sex? Why wouldn't we be paying attention to this? Like clearly our bodies were meant for pleasure. And so
yeah, and maybe pleasure is the way that we get incentivized into getting pregnant.
Right. Well, yes and no though, right? Because like our clitoris is so far from our vaginal opening that like some women struggle with like having an orgasm just from penetration alone, right? Like lots of women
Most women.
Yeah.
Right.
Yeah. I think it's like 10 to 15% of women have orgasms from penetration. And even then it's not reliable. You know?
Depends on the guy.
Depends on the guy. It depends on like, it depends on like where your
on the
mindset
skill
is.
set.
Yeah. For me, it depends on like what the hell I'm thinking about. Like if I'm like, oh God, this is never going to happen, or, oh shit, I have to do 6 things for the kids before tomorrow morning. Like I'm not thinking about it. Right. But if I'm thinking about it, or I'm like deep in a fantasy somewhere, like it'll happen. Yeah.
Yeah. So interesting. So what do you think wires women for being interested in sex versus not interested in sex? Because I feel like that changes across our lives.
Oh, it totally does. I mean, especially when we're unmedicated and younger. So by unmedicated, I mean like if we're not on something that's really going to kill our drive, or as I like to say, our drive, because it's not really a drive. It's kind of like a car with a gas and a brake, or a stopper and a something that makes you go and something that makes you stop, because it's twofold. But yeah, if we're not on like something that's going to kill any biologic part of a sex drive, or we're not
like an SSRI or something
birth
else.
Control, like God, oral birth control is like, it's sucky for a number of reasons. One is it can kill any kind of like sexual excitation drive, kind of that's like a biological inert drive, because it stops ovulation, but also because of how it gets broken down in our body after being metabolized through our liver. It increases this circulating protein called sex hormone binding globulin. And that will circulate at a higher level.
By the way, hot name.
It is. SHBG. but it does. It binds to sex hormones. So it'll bind to estrogen and it'll bind to testosterone. So your liver pumps out more of it. More of your hormone is circulated bound to it. And then it's like, it's not freely able to be active. Plus, we're taking the whole ovulation piece out of it, which is when most of us get super horny, right?
Right.
Yeah. So oral birth control, you'd think it would be freeing to be like, yeah, I can fuck whoever I want, but I'm not actually going to get pregnant. But with time, it can actually kind of be a damper biologically. So without those things, we definitely have an evolutionary kind of like protective mechanism as women. We are like, we have this hidden kind of ovulation, right? So it's not obvious. Like we don't go into heat per se, like dogs.
Right.
Right. So it's like we have hidden ovulation. We don't have like obvious what they call estrus. Like, so we can kind of, it's a safety mechanism, I guess they think, evolutionary biologists think. And so we definitely have times during our menstrual cycle where we're more obviously horny, where our desire seems spontaneous per se, instead of like responsive, which it is. But, I honestly think that lack of education, lack of information about it, lack of moms knowing, or even growing up in the ability to know that like, oh, my body's for pleasure. If your mom wasn't super open with her own sexuality and wasn't talking to you about it, you weren't really learning this stuff at school. The internet didn't exist back when most of us were younger. We didn't have free ways to find really good information. Like everything was censored. So it's kind of hard to say for sure why we're wired for this, but we don't know. But I think a lot of it is like society. A lot of it is how we were raised, and how we're, I don't know, how we're like almost groomed by like things that we have no control over.
Yeah. And then fast forward to this phase in our lives when our hormones are changing, and maybe we've been in long relationships. And what my personal experience was that I was married for 17 years, and for the last 10 years, we did not have sex. And I had come into the marriage a very sexual person, and was like, okay, great. This is going to be what our sex life was in the first couple of years. I was like, great. This is what I'm signing up for. This is really what I want. And then gradually, through a series of life, interpersonal and biological stuff on the part of my partner and what was going on with him, like gradually we just stopped having intimacy and trusting each other and wanting to be vulnerable and being willing to connect in that way. And I sort of said to myself, this is what happens. People get married, they are married for a long time, and then they stop having sex, and then that's just what their life is. You just don't have a sex life.
Yeah.
And then, of course, when I got divorced, I'm a maniac.
Yeah, good for you. I like live vicariously through you, because that's awesome. But yeah, I mean, it's a real problem. Like the majority of women I see for counseling when they have problems with their sex lives is one of two things. It's either pain with sex, and it's either because like they've kind of been through your scenario, and then they all of a sudden are sexual again, but they went through menopause during that transition time, right?
Right.
And then all of a sudden their vagina's like super dry and it's uncomfortable. And they're like, what happened? This didn't used to hurt. Or it's low desire, like so much like low desire. And it's like almost every person I see. With the small caveat, I've seen a couple of very young women whose bigger problem is like orgasm, or comparing their orgasms to others because of like social media. And I mean, I'm knee deep in a lot of sex stuff online and in the media and in the actual like academic literature. I have lost track of where people are like comparing their orgasms to others. I haven't fallen down that rabbit hole yet, but
I haven't either. I want to, though.
I know,
I'm curious about that.
It's out there though, because I've seen a couple of younger women who are like, I think I'm having an orgasm. I don't know if I am. And it's not that good compared to what other people have, because I actually had a patient who I helped her with it because she really wasn't sure. And she came back and she's like, oh, I'm having it now, but it's still not as good as everybody I see online. And I'm like,
what does that mean? In porn?
No, I don't.
Like
she wasn't watching
orgasms?
Porn. No, I think it's like people on, I don't know if it was TikTok, but somewhere there were girls that she was following or talking on social media that were like talking about how mind blowing their orgasms are. Well, first of all, good for you. If that's real, like go out there and get it. Cause a lot of women are missing that and have been for a long
Yeah.
time. But two, it's like, God, I hate that we're comparing things, because the more lousy you feel about your body, your sex life, your body's response to things, like it's kind of a vicious cycle. Like you don't do well if you've got a negative body image or a negative kind of like mindset when it comes to like sex. It's
There's
not
so much to unpack here, Maureen. Like,
right.
uh, first of all, it never occurred to me that there are no models of knowing what it looks like or feels like for women to have
Yeah.
orgasms. Like, oh, the culture is so focused on male erection and ejaculation and satisfaction.
Yeah.
And it's like, did you come? It's like, well, how come you can't tell?
Right.
And B, like, every woman's orgasm is different.
Yeah.
So, I mean, that's what I hear from men is like, oh, like I had a partner who orgasmed like this. I love to talk about sex. So when
Yeah.
I'm in a sexual relationship with someone, I want to know about all their things and what they know and what they've heard and what they've learned and what they've seen. And it's so interesting that the reporting from the field from these guys is, oh yeah, some people are quiet and some people like kind of sink into themselves and their eyes roll back and some are shaking like maniacs and it's so interesting to me that we don't even know what orgasms look like and that there's such a wide range because culturally, who gives a shit?
Right. Right. Yeah.
Like, except that it's so good for
It
us, as
is.
your friend Dr. Nan Wise has
Oh
studied and
man.
reported.
Yes.
Like,
Yeah.
it is so good for us. It oxygenates our brains. It makes us younger and more alive, like, and more connected to ourselves and our partners. Like, it's
Yes.
so healthy. It's built in. It's clearly meant to happen. I'm surprised even to realize that I had never realized that there wasn't like somebody needs to make, maybe this is you, a little book that's like the sexy book of orgasms. And it's like, and there's a little button you can press to hear it. And maybe it's like, or maybe it's like flip book of
Yeah.
videos. How are we going to learn what other people are experiencing and then go, well, is what's going on with me is normal? Like, we don't even know how to talk about it,
No.
report on it.
No, we don't.
Like,
And we make everything kind of like a pathology too in the world of
yeah,
sex. Like it's everything's fine, or it's like you have some kind of disease or disorder. And we tend to think that there's lots of stuff in the world of sex that's abnormal too, which is I think another place where education falls off. Like people think
yeah,
that things aren't normal, and literally almost everything that our bodies do and that we do with sex is normal. The orgasm's one piece of it, but like fetishes are normal as long as you're not hurting yourself or someone else. But people
right.
look down their nose at you if you've got a fetish where you like to come, but you like to do it wearing like, I don't know, like a strap on or
Antlers,
something.
reindeer antlers,
Right,
whatever.
right, right,
Like,
right. Like knee socks and fairy wings, whatever it is. Right.
whatever.
That's not necessarily wrong as long as you're not inflicting harm on yourself or your partner. Like there's so much that's normal. But you're right. The orgasm thing is interesting. And I've had several women who are afraid to get there. I mean, like when I try to explain it to them, like what it's like, clearly I only have my own physical experience of it. But, a lot of them will tell me, I'm like, it's like this tension and it builds and you feel like things are getting really intense. And then I'm like, and then I bet you back off because when they're I give them homework and sometimes I'll have them like work on their own orgasm, go get some
Yeah.
toys, go do this. And they'll
I
be like,
needed to do that when I came out of my marriage. I had sort of lost my connection to my orgasm and I had to get it back.
yeah, oh no, you got to get it back.
Yeah.
Yeah. And
Yeah.
so when they're out there with these toys and they're like, oh, it gets really intense. I'm like, but it's going to be amazing. It's not going to hurt you. Like, it's going to feel so good. It's going to blow your mind. You just have to stick with it and not back down. And I've had a couple women come back to me and they're like, oh yeah, I finally figured that piece of it out because they were almost afraid. And sadly,
Is that about fear of losing
it
control?
might be. And it might also be that they just won like their background. They never knew about it. They never knew they could have this kind of pleasure, especially older women. The younger women know a lot about this stuff, whether they've experienced it or not, because they've got the endless like pile of misinformation and information that's out there on the interwebs these days. But the
Yeah.
women, like the Gen Xers, the ones who are coming to me going like, I still want to have sex. My vagina's dry. Help me. Those women
Yeah.
didn't have the same kind of like education, like formal or not. We just didn't really get that. And if you had a partner for most of your life, like a long-term relationship, right? And it was like not good sex, or it was pretty perfunctory. It was like, I take my own clothes off, and then you maybe go down on me, but then you just decide to penetrate, and then that's the end of it. And I don't think I've ever had an orgasm. Like those women who just get stuck in this rut of like boring, same old stuff, and their partner's not looking to pleasure them. Like it's like rewriting a big script to get them to realize like, yeah, your body will do this and your sex will be better if you do it. And then they sometimes run into the problem where they're like, oh God, I know what this feels like now and I want to do this, but their partner has no interest. And I'm like, oh.
What do you mean no interest?
Yeah, I mean,
That's
sometimes it's
heartbreaking.
sad. Sometimes they have a very excited partner and very supportive partner, but sometimes the partners are just as clueless. And when women find their bodies and they find their pleasure and they actually get to that, when their sex isn't like accommodating that, it's hard. I've had a lot of women, when I counsel them, they don't talk to their partner. And if they're having a problem with their orgasm and they overcome that, they still don't want to talk to their partner about what's going on. So sometimes they don't give their partner a chance because they're just like, oh, he won't listen to me. But sometimes they do, and their partners are like clueless. And then it's like the onus is on her to like completely educate them and like change everything they've been doing forever. It's hard and frustrating for them when they have like these kinds of issues.
Yeah. Yeah. I want to go back a little bit to low libido and this idea of low libido and low desire, because I think this really needs to be unpacked for women. So I have just a lot of questions.
Yeah.
Like when we're saying low libido, what are we comparing it to? Like, how is it measured? Because who's to say what one person's low libido is relative to one person's high libido? Is it in relation to men and what they want, or your partner and what your partner wants if you don't sleep with men?
Fortunately, this kind of stuff. Yeah, right. Because like women who sleep with women have way more orgasms than the rest of us. Yeah. But no, I mean, so stuff that's kind of falls along this diagnosis line, and low libido is kind of a common term. There's a code for it. But what we really use is like HSDD, so hypoactive sexual desire disorder. And that's usually it's really subjective, but it's the person's own complaint. So like if you feel like you have no interest in sex and it's been bothering you and existing for about 6 months or more, whether it's relative to before or you just feel it's a problem, it's a problem. And that's when we give that diagnosis. So fortunately, we're not in this case comparing it to men or anyone else. It's your own sensation or your own feeling or being bothered by that low desire.
Or bothered by it because your partner's bothered by
it.
Because it's impacting the dynamic in the relationship.
Yeah.
And then is it your responsibility or people like you to convince women who don't care about sex to take steps to increase their libido? Like, because I have heard over and over again, like I am doing a podcast where I talk about sex all the time in midlife because it's interesting to me and I like it. And it's been a rebirth for me.
Yeah.
And I want it for people if they want it.
Yeah.
But so many women, like I was, could tell you, I take it or leave it.
Right.
Fuck it. My life doesn't really have space for that. Why should I care about that? That doesn't really matter.
God, and kids and our careers and like parenting and like the 80 million hats that we wear.
Domestic fucking labor.
Misery. It's so hard. Like when we get to be in our 40s, we're like pretty experts in our careers. We're pretty productive. Most of us are like parenting kids that aren't necessarily babies anymore, but still need parenting. So the craziness of everything we're doing does get in the way of it. And so some women are like, I don't miss it, but some of them are. And what I find is when I bring it up, whether it's just in my regular like gynecology practice or to the women that kind of seek me out, like if the more they think about it, the more they realize I am missing this and it matters. A lot of them, some of them don't. And when they don't, that's okay. Everything's a spectrum in sexuality, like literally everything, like romantic attraction, who we'll partner with, who we'll have sex with, who we love, how we love, gender orientation, sexual orientation, all that stuff's a big spectrum. And there are people who are asexual or who are closer to asexual or demisexual, kind of where it takes a lot to be interested. But then there are people who, I have a friend who like, he's great friend of mine, but I think he'd pretty much have sex with anyone very openly, very kindly, like doesn't matter, male, female. And that's
Just
kind of
pan everything.
the other end,
Yeah.
right? Like that's the other end of this where it's like sex is just sex and I love it. And I don't care who you are for the most part. Like I want to do it. So it kind of again depends on where that woman is. But man, we get snowed by like midlife, by parenting, by careers, by the hustle and bustle of like running kids to travel sports and trying to like, I don't know, maybe get to the gym, maybe sleep, walk a dog. Like it's easy for
Right.
sex
See
to
a friend, have a phone call.
right.
Like, yeah.
Yeah. So it's easy for it to fall behind. But when women kind of wake up a little, because you either bring it up, and most doctors don't. Like there's a recent study that showed that like women wanted their doctors to ask them about it, whether they had problems or not. And only like less than a third of people will even physicians or clinicians will even bring it up in the exam room, which is stupid. It's just, it's especially for like gynecologists and urologists, like that's what we do. That's where we're supposed to be experts and we're not.
Right. So interesting.
Yeah.
I also think that women get dissociated from their bodies and sexuality in midlife because their bodies change.
Oh God. Yeah. I'm there.
And
it's horrible. I'm trying with everything I know academically and intellectually and professionally to not let it kill mine because I've got 2 teenage girls and they are busy. One of them's going to be a senior in high school and my husband is busy and we spent the entire summer in like different locations. He was with one, I was with the other. We didn't do anything fun but sit on softball fields, if you can count that as fun. And so
I wouldn't,
no,
but other people might.
I mean, I love watching my kids play and I don't have much longer with my oldest. But the thing is, like, things are so busy because we still both had to work full time and then we both had to run people places. And it's like, meanwhile, like, I am squarely in perimenopause. I have never been thin. I was always athletic. I had boobs and kind of a rounder butt and thighs, but I did kind of have a flat abdomen. I haven't really gained weight in the last year, but I had to go up a pant size. I'm like so pissed.
It's so insulting.
Yeah,
it is.
And it's killing me. And I know that it is going to kill any sex drive that or drive again in quotes, but like that desire, that interest, like when you're starting to get pissed off about your body, and it's hard to undo some of this stuff that happens when our estrogen levels start to fail. Like it really puts a damper on even a healthy sex life because you really internalize those body changes. It's miserable.
But we believe that aging makes us unappealing to our partners.
We do.
But it makes us unknown to ourselves.
Oh, it does. It's like, I don't recognize this body. I barely recognize my white head of hair because
which is gorgeous, by the way.
Thank you. I got fed up. I was like, I can't keep coloring my hair anymore. I don't have time to go every 3 or 4 weeks. So it took me about 18 months, but I grew it out. And my kids are like, Mom, it's hip. And I'm like, it's hip for now. But when I'm 55 or 60, it's just going to be like, oh yeah, you're old. It's hard to start doing it at like 45, 46. When I could have done it in my
movement.
I could have done it in my mid 30s. I know, but that's what I say to my kids, right?
You never would have, though. You never would have.
I know.
Like it takes a very certain person to say, I'm cool with my gray and this is going to be how I rock it.
I'm trying to own it, but man, like, you know how fads are. Like right now my daughter's dressing like the 90s and I'm like, oh shit, that's back again. Like, what are you doing?
Those little tiny low-rise pants are happening in my house. And it's like, oh girl, those were never flattering.
No, but then there's part of me that goes, God, if I looked like you guys did when I was a teenager, I would have been all over that. Like I would have been half naked all the time. Like, show it off.
I mean, and I live in Los Angeles, like, people wear nothing.
Yeah.
Like the kids really wear like the shortest shorts and the littlest shirts. And like, I grew up in Baltimore, Maryland, like
yeah, East Coast
in the 70s and 80s. Like we did not dress like that. No. And so it's about how do we raise young women to embrace their bodies, to embrace their sexuality, and to be comfortable in their own skin and also empowered. I mean, it's so interesting. And this is a pivot to a totally other topic, but we were talking about this in advance of the call, which is like, how do you raise sex positive daughters? And there's so many role models out there. These young singers who are the most popular performing artists in the world now, like Chapel Roan and Sabrina Carpenter. And these girls talk really frankly about sex and sexuality and what it means to have a casual sexual relationship and guys wanting to call it casual. And like they're interrogating all of these things so publicly and frankly. And like my ex sent me a text like, you need to listen to this song Casual
Oh,
by Chapel
I
Roan. And I
love
said,
Chapel Roan.
she's the coolest.
Yeah.
And I said, no, actually, our daughter and I have had a conversation about it. And she's aware that the song is a social commentary
Yeah.
about the nature of sexual relationships among young
Yeah.
people. And
I know.
he was like,
I love it.
so psyched that I was having that conversation.
I love it because I just actually bought my oldest the Midwest princess hat because our homecoming theme is kind of, they're doing like a army kind of camo thing. And she's like, that's the hat I want. And I'm like, all right. But I said to her the other day, I was like, you know what she's talking about when she goes, I hear you like magic. I've got a wand and a rabbit. And my daughter's like, yeah, Mom, I know.
My daughter had to tell me.
Oh,
I was like, because I hadn't really thought about it. And she was like, oh my God.
My brain is always there. And I'm like, yes. Like,
yeah,
it's
amazing.
It is.
It is amazing.
But
it's still so hard for them to figure out how to navigate.
Is.
My son too, my twins are 13. My son is like, there's a boy in my school who has a folder of pictures of girls' bodies that he's taken without their consent at school. Like he's taken pictures of them, and that guy is a creep, and that's not cool. And I love that I have a son who brought that up with me and just kind of wanted to check it with me to be like, what do you think?
No, that's awesome.
You know?
I mean, what I found in a lot of this, whether it's like people's relationships with their partners in my office or just in general, it's like, we've got to talk more. And like, you're doing everything right. Like being able to have an open conversation, having enough of just a basic education so that you're not doing harm. I mean, that's the same premise that I need to take with all of these clinicians who say dumbass things to their patients. Like
what?
Don't do harm.
I want to hear the dumb
Well,
things.
I had a patient recently who was like, yeah, our sex life was just starting to get better and things were good. But then she had a couple of issues, but then her partner started to have erectile dysfunction problems. And I was like, did he see his doctor? And she was like, oh yeah. But like it started after he went on like blood pressure medication. And the doctor said, oh, there's no way that's part of it. And I'm like, well, first of all, yes, there is. And how do they not know that if they're prescribing beta blockers? And like, that's totally wrong. I mean, one, when you have erectile dysfunction, you're a higher risk for like cardiovascular disease as a man, because like our sexual dysfunction in men goes up as they age. But erectile dysfunction, because it's a plumbing problem, it is kind of a marker of cardiovascular health. And there's like a risk of having a heart attack in 3 to 5 years if you are not also paying attention to other stuff going on when you've got erectile dysfunction. But the thing is, like, you're doing the right thing. You're treating the high blood pressure, but there's other things you can use. If this created erectile dysfunction where there was none, like, don't just tell them that, oh no, it couldn't have anything to do with that medication, or tell women like, yeah, you're having trouble, just go have a glass of wine, or try to relax more, or what. I mean, it's just, that is stupid stuff. And people get told that all the time. So
yeah, it's so unfair.
It is.
It's so unfair that we suffer from the lack of the clinicians that we depend on.
Yeah.
When they don't know enough.
Yeah. Yeah.
You know?
And I hate throwing my whole profession under a bus, but like
you're not, but this is the work you're doing. That's why you're called to do it.
There are people out there too. I mean, you've talked to Kelly Kasperson. I mean, she's a urologist.
Absolutely. She's been on the show.
Yeah. And Rachel Rubin, another urologist out there jumping up and down. I'm trying to be one of the OBGYNs out there jumping up and down because again, like we don't learn this stuff. A lot of us took this on ourselves or spent a lot of extra time trying to do the right thing and also to help people because this is so important to our lives and our happiness. Is like, I tell my husband all the time, like, I'm tired of just wearing my mom hat and my wife hat and my professional hat, like my doctor hat. Like, I want to be me again. Like, I just want to get back to where I was or who I was when I was younger and somewhat carefree with this middle-aged body. Do my best. But
it's so interesting though, because I think that is what is happening as a generation.
Yeah.
Where we had this era in our 20s when we were free and experimental and kind of said fuck it to the rules and all that stuff, the very Gen X-iness of us.
Yes.
I loved that girl. I didn't have a full-time corporate job until I was in my very late 20s because I was freelancing so that I could be an artist, and I was traveling whenever I wanted. And I was really trying to live my ideal bohemian adult life. For what I saw was what I wanted. And then I wanted grown-up things.
Yeah.
And I wanted a career with a capital C. I call it like the capital letter life. Like, I wanted a career. I wanted a family with an F. I wanted all the adulting stuff. And that for the last 20 years is what we've been doing as a generation.
Yeah, we have.
And now, as the burdens of parenting lessen, or we make changes in our marital status or whatever, we're going, hey, remember her?
Yeah.
She was fucking fun.
Yeah, she was.
I miss her.
Yeah, absolutely. I do miss her. And I mean, I say this all the time. Like, I wouldn't trade my kids for anything in the world, and I love them. And I don't want to like wish them away or out the door because it goes fast. Like, I've got a 17-year-old and a 13-year-old. And the 17-year-old, like, every time she does something now, she's like, Mom, this is the last time I'm going to do this. And, and I'm like, stop
saying that.
Stop. But I love her as a almost fully formed frontal lobe human being who's becoming kind of an adult, like not 100% there, but she turned out okay. And she's kind of navigating the world the best she can. And I think, again, just being open and talking about it. And most of the time she's like, I don't want to talk about this with you again. Because my husband's a pediatrician. So between the two of us, like, there was no question, like, we couldn't answer, although he did turf everything sex and genital related to me always, because he's like, well, you trump me like more. And I
have the parts.
I do. But like keeping an open dialogue, like I'm surprised just through osmosis, because my kids really, they don't want to talk about it a lot, or they will ask me something and I'll explain it to them and then they'll be like, okay, that's enough. And they'll walk away. It's hard to strike the balance because like when I am with their friends, like I've had them ask me like a gazillion questions. Like we were at a softball tournament a couple of years ago and we were walking around Target, like waiting for our afternoon game. And like half of the girls were like, what happens when like a placenta doesn't come out? Or like, what happens when you like, how do you use a tampon the right way? How do you pick the right size?
Right.
And I could see my daughter just like, she knew the answers. She didn't say anything because she's like through like osmosis. I think she's learned. She's kind of like Otis from like Sex Ed, that Netflix series, Sex Education.
Yeah.
Sometimes I call her Otis because she knows. But like they're asking me all these questions. And then she was like, God, that was embarrassing. I'm like, do you know how useful that is? Because if the girls didn't get it, they might not have never known like how to pick the right size tampon. And honestly, their moms are always like, if they have any questions, can they call you? And I'm like, hell yeah.
That's wonderful.
Hell yes. And I'm in New York. So, I mean, it's good. But I was like, if they need anything, if they get into trouble, like I'm always here. You can always give them my phone number. And I have had girls text me, like friends of my daughters or athletes who've played on teams in the past with any of my daughters, just to ask me a question. And I'm open to doing that. I wish there were more people out there like that. And I hope I'm not embarrassing my kids by doing it. But I think ultimately I'm not. I think
no, because they know that your heart's in the right place. And like, while that might feel unconventional to them, they're probably proud of you for knowing what you know and for being as open as you are.
I think so. Yeah. My little one,
they might not ever admit it.
No, I almost like bawled my eyes out the other day because my 13-year-old went from like really kind of writing like a younger kid to, they had this assignment, like 10 things I've always wanted to tell you. And they had to kind of write this thing in the same like style of that author. And man, she wrote it to me and she was like, Mom, one of them was like, Mom, you're beautiful. Like give yourself some grace. And Mom, I'm excited at how hard you fight for things that are important to you and to us and to women. And I'm like, what?
I'm literally
I was crying. I'm like, I gotta like print this out and frame it and like hang it up somewhere because I mean, that's in the end of the day, like I'm doing okay, but I want everybody to be able to do this. I want as many kids and adults as possible to like start talking about this stuff because it means a lot for your relationships. It means a lot for their health and safety, because the more you talk about it openly, there's lots of
Yeah.
studies that show the less likely girls are to like get pregnant, have sex without condoms, like get a disease, like they'll delay first having sex and do smarter things about having sex if they have like an open
Yeah.
dialogue with their parents. And it's like, give it up, man. We're all having sex. Like, we're having it. I wish we wanted to have it more, most of us, but oh, my husband, like the last time I was at an outdoor concert, it's like a venue, like 15,000 people. It was mostly adults. And I said to him, look at this. There's like 15,000 people here. It's sold out. And he's like, yeah. And I'm like, they all have sex. They all have lots of sex. I'm like, that's 15,000 people and their relationships are important to them. And he's like, yeah, I know. Like, we need to talk about it more.
You get excited about that.
I totally
right?
do.
Like I get excited about that too, because it's such a beautiful part of life.
Right?
And it's so life-giving and stress reducing.
It
and
is.
like it's unlike anything else we get to experience
It
as
is.
human
It brings
beings.
us pleasure. It helps get us, I mean, I know Nan likes to talk about this too, but like it gets us out of our funk. Like we have a lot of anhedonia. And by that, for people who don't know what we're talking about, like it's the Eeyore. It's like, oh, bother. Like this is just how it is. I send people off sometimes with just the homework assignment to like, go do the thing you used to do that made you freaking happy when you were 20. And for some women, that's like hiking again, or like painting, or like going to concerts, or being involved in like, I had someone the other day who used to do improv, and she like dipped her toe back into it. And she was like, oh my God. She's like, I actually am like starting to feel like I've been asleep for years. And sex and like the joy that we can get into our lives, joy, the opposite of anhedonia, the like involved excitement and interest in our life, right? Like those things play off of each other, and they're both really important to like live a happy, healthy life.
Yeah. I so agree.
Yeah.
Okay. I could talk to you forever.
Oh, I could talk to you forever.
We should probably go get a drink.
Next time I'm in California.
Okay, good, please. But here's my question for you. What do you want our listeners to know about what their options and choices are, about how they handle, how they plan for and think about their sexuality and menopause at this stage in their lives?
Yeah. Well, I certainly don't want them to write it off. And the one thing I tell lots of women, and trust me, it sucks. Medicine these days, we don't make money unless we see lots of people. And most of us work for health systems, so we have to see lots of people. And the key is like trying to get into that like 15-minute visit, the ability to kind of be a human. And if people have needs that you can't meet, to bring them back, or if people feel like their needs aren't being met and they're not being heard, to find someone. There's lots of providers out there, not all physicians. There's some great NPs and PAs who've been, trained in both menopause and sex, or one or the other. And there are places like the International Society for Women's Sexual Health, which is a scientific, academic kind of organization. It's worldwide, but they have resources on their website, and you can find providers who are members. So clearly those docs and APPs are interested in women's health. Same thing with the Menopause Society. There's lots of clinicians. Oh, Mary Claire Haver, who is an OBGYN, who speaks the truth a lot about menopause and how to get what you need from your provider, because she also is like, we don't get taught that stuff either. And we're freaking like female parts doctors who have to come out of residency surgically competent, but we don't spend a lot of time doing some of this like office-based stuff. She'll tell you that like you need to find someone who will listen to you and maybe go in there educated. If you've got an agenda, you want to know why you have no interest, you want to know how to fix it, bring that up. But like, one of my superpowers besides talking about sex is like listening. And I'm like this with my patients too. Like they know if it's been a week since I've had sex, sometimes I'll let that slip out. Or I had a lady once who was like, your sex life must be amazing. And I'm like, it can be at times, but you didn't ask me about my solo sex life, which is a whole nother entity in and of itself.
Which is a whole other episode
too,
it is. Because solo sex teaches you what you like and what you don't like and what works for you.
Yeah. So I mean, as patients, be your own best advocate. I know it's hard, but you can seek out from like friends and family members who you can trust, like if they will listen to you or not. And you can find people on these websites where professional organizations where they've done the extra work. And so your odds of kind of getting the help you need are better, because let's face it, like we are all aging. I say this to everyone. We're essentially all aging at the same rate at the same time. Like even me and my teenagers, and we only get one kind of go around with this, right? So like, why not live it to the fullest? And why not seek help from someone who's going to listen to you and who can help you, right? Because there's all sorts of stuff we can do, especially in menopause. Like there's lots of good data about use of testosterone in postmenopausal women. I love it. It works. It really does. And when your ovary shuts down, why not supplement what's used to be there? So so be your own advocate, find the people who know and care. It's hard, I think, as a patient, and it's hard for the clinicians, but there's some of us out here who love this and we're talking about it. And I'm going to not only educate the physicians of the world, I'm starting to do some more like community stuff where we're just talking to groups. I'm talking to a group of older people in a week or so at the Jewish Community Center locally, so that I can, so we can get that information out there. Like I don't get paid for any of that extra stuff, at least not yet, but like it's important to me. So I'm out here trying to just make it comfortable and easy for people to talk about and find the help they need.
That's so amazing. Thank you so much for being here, sharing your passion, your mission.
Oh, you're welcome. It was so much fun.
I'm excited to be an amplifier for you and the message that you're putting out there.
Thanks, Erin. You too.
So much fun to talk to you.
Like the world needs more 40, 50 something women who have a drive and a purpose and like going out there and getting it done and living your best life.
Indeed. And amen. Thank you so much.
You are so welcome.
Thanks for listening to Hotter Than Ever. On this podcast, I am here to help you claim and cultivate your pleasure and a positive relationship with your 40-plus body. I am doing that myself. That has been a lifelong mission for me. And now I am sharing this with you because honestly, the more work I do on myself in this space, the better I feel walking around just in my everyday life. If this conversation helped open your eyes to things you've been trying to avoid about how your body and sexuality are changing in this chapter of your life, please spread the word and tell someone near and dear to you to listen to Hotter Than Ever and to follow us on any and every podcast platform that they are on. And if you haven't commented on any of our posts on Instagram, start that conversation now, and I promise I will respond directly to you within a week. How does that sound? Comment on our posts, drop us a note, let us know if this conversation spoke to you. Hotter Than Ever is produced by Erica Gerard and Podkit Productions. Our associate producer is Melody Carey. Music is by Chris Keating, with vocals by Isa Fernandez. I will talk to you next week, hotties. Do you know how sexy and gorgeous you are in those fall colors? Jewel tones are really bringing out the color of your eyes. It's funny, every time I talk about the seasons, I think, do we have seasons anymore? I live in Southern California. It's about 100 degrees here. Like on any random day in the year, doesn't really matter what season it is. You really do look great in those jeans.